Hey everybody, today's episode is a little bit different. We've got some special guests with us today, and they're going to cover one of their specialties, which is depression. Hey everybody, this is Dr. Squires Squared.
It's a channel where we have casual and candid conversations about everything audiology.
And if you're not sure what audiology is, hit the like button, make sure to subscribe, and hit the little bell so that you get notifications about all of our new content, and we'll make sure to tell you all about it.
Yes, and we are really excited about today's episode. This is part 4 of our 4-part series, Your Hearing Loss Has Baggage. And we did something a little bit different. We brought in some special guests that are going to talk to us about the topic today, which is depression.
That's right. We want to introduce Dr. Stephen Gibbons and Michael Moore. They are co-owners of the Counseling and Wellness Center here in Parkersburg, West Virginia, and they have several locations across the Mid-Ohio Valley and the state of West Virginia. We'll put their links to their Facebook page and their website down in our description, so make sure to check them out. But without further ado, we'd like to introduce our special guests who will be talking about depression.
Enjoy.
We really appreciate the opportunity to be here today. Probably the best place to start would be trying to understand really what depression is. A lot of people think of depression and they think sadness, but there's a difference between just general melancholy or sadness and true depression. The true depression is where a person feels a persistent, ongoing sadness and depressed mood that lasts for longer than 2 weeks. It's something that interferes with their daily life. And when I say interferes, I mean it changes the way that they go about things. They start avoiding people. They really don't want to talk to people as much. They find themselves maybe coming to tears a little quicker, a little easier. They don't enjoy doing activities that they used to enjoy doing. So maybe they were a person that really liked to hike, or they like to go out and work in the yard or the flower beds, and now they just are not interested in doing that as much now. That is something that really starts to make a person believe, when that's persistently going on, that now we're dealing with something that is a clinical depression, not just your everyday bad day or blues.
And you're going to see this a lot of times when people, when they think depression, they think people can't smile, people can't laugh, they're not allowed, but you'll see even those things come through. Depression, like Mike is saying, it tends to be more long-term based. And also in that is that it tends to affect various aspects, including sleeping. They have a hard time being able to get to sleep or staying asleep. Eating flux of more or less on those. Not being able to move around, being able to, again, isolate, to not want to connect with anybody around them.
I think it's really important to point out that depression can sometimes come on gradually. And because it comes on gradually, it's kind of like the old adage of you put a frog in a pot of water and you start to gradually increase the temperature. That frog doesn't jump out because it starts to acclimate to the temperature of the water, and it doesn't really notice the temperature change. And that's the way it is with depression, is that because it comes on slowly at times, it doesn't always just hit you out of the blue. Because it comes on slowly, you might not realize that you feel that much different than you did yesterday or the day before. But what you have to really look at is over the past couple of months, has your life and your lifestyle changed drastically? And that's the big difference that you have to look at. Don't look from one day to the next, but look at in time periods.
Think of it in the sense of the hygiene. If a person has a bad smell to them, they become desensitized to their own smell. They're not going to be able to recognize that they're smelling bad. In fact, people around them are going to know that, and that's going to be the difficult part. When you know something, how do I approach somebody with this?
And Stephen, I'm glad you brought that up, because there's been something I've been able to talk to you about.
So when it comes to having the conversation, the hard conversation, the difficult conversation with someone else, you don't just want to go in and say, hey, guess what? I think you have depression. You know, that never works out. And because this is a very sensitive subject, you know, for anybody with those. And now we want to help to, I had a dear friend. He lived over in Baltimore, Maryland, and he had lived by the harbor, and he'd always had these people who had clams. It's a real big point, oysters and clams over there, and they would always take these knives, and he always noticed that a lot of the guys by the harbor opening these clams, they'd always have these cuts all over their arms because they were trying to force their way in of getting to these clams. And he said, I found a neat little trick. He said, when I put that clam in warm water and I get it cleaned off and it's nice and warm, it automatically opened up, and then I got the pearls that I really want. One of the biggest problems in communication is that we tend to listen to respond, not to understand. And one of the best things that you can be able to do with anybody who's having a hard time is trying to be able to help understand where they're coming from first. Then you can point the direction of where they really need to go. So I've always found that help's only beneficial when it's wanted. And whenever we can help to get that clam opened up here, we get off and put them in a place where they feel warm and they feel comfortable to be able to open that up, then they're going to be open to want to go find help that they need.
If you start in saying that something that you know about, and that is that something about how you feel in the relationship with them. And so maybe you're going to come to them and say, hey, I really miss this fact that we used to talk every day. And I really miss that. I've noticed that, you haven't seemed as talkative. Is there anything okay? I mean, and so you start by talking to them about something you know about, which is you. And it's not meant to bring about guilt or anything like that. It's just to let them know that sometimes people don't realize that their depression or what they're feeling does have an impact on other people as well.
And one of the things that you're going to recognize as a friend is that you know what their normal behavior is. You know how they act, you know how they interact with you. And when you point out the things of, hey, I've been noticing that we haven't talked a whole lot. I've noticed that we have been a little bit distant there. Every time I try to call you, you haven't picked up. I've noticed that, every time I come over, you're, in your room. Whenever we have those specifics, it can help get the conversation started. Because it really genuinely shows that, hey, I'm not trying to be critical of you. I just really care about you and I'm concerned.
One of the things that's very important for a person who might be wondering if they're depressed, sometimes people start to ask the question, am I depressed? I think I might be, I'm not sure. A lot of times people will tell you, don't go to the internet, don't go to the internet. This is one of those places that I will tell you is that might be a good place to start, not in getting help, but in determining whether or not you're depressed. That's the time to leave the internet. And now pick up the phone, and I would encourage you to call a mental health professional in your area. You can usually, those things are easy to find. There's all kinds of resources that are out there. They try to make themselves easy to find either in your phone book. You can do a quick internet search on mental health in your area. But I would encourage you to go and see a licensed professional. Because that is something that it is very serious, and it's not something to be taken lightly.
And when you can also go to your primary care physician, or different professions. You're going to have somebody that you really trust in a profession, and they are trained to be able to give out appropriate referrals, whether that be your dentist or your doctor, any of those. Whenever they see things here that is, especially in the mental health, they're going to know someone in their area here that they're socially connected with and say, you know what, maybe it might be best for you to go talk to them. So no matter where you are, if you're reaching out to some type of professional at this point in time, you're going to benefit to really know where the direction needs to be to help get you clarity and direction for the purpose of what you're looking for. If you're someone who has a question or concern, you can reach us easily by a couple of different modalities. One, you can give us a call locally at 304-422-7300.
We have 3 offices. We have one in Parkersburg, West Virginia. We have one in Belpre, Ohio. And we have one in Taze Valley, West Virginia. So if you're near any of those areas, feel free to give us a call and we can get you in touch with one of those offices and get you set up with an appointment.
You can also reach us online at www.counselingandwellnesscenter, all one word, .com, and you can reach any of our offices on there to find the information available to you.
Thanks so much.
Thanks for connecting.
All right, everybody, thank you so much for joining us today. We hope that you enjoyed this episode. It was a little bit different for us, but we are so excited to have Dr. Givens and Michael Moore with us today to talk about some of their expertise.
Yes, and as always, if you have questions for us, we'll have our contact information on the screen, and then we also will have the information available for you to reach out to our special guests if you have questions about depression. And we hope that you'll go back and watch the whole series, Your Hearing Loss Has Baggage, as they're all really important and relevant topics.
That's exactly right. So if you're curious about how hearing loss and depression have maybe affected you or a loved one, make sure to shoot us an email at info@hearwv.com or give us a call at 304-428-2403. Remember to like and subscribe, and until next time, thanks a lot.
Thank you.
See ya.